Hey friends, it's Christina. Welcome back. I am so happy. Today I have Dr. Whitney Sippl, and we're going to talk all about recovery after baby. So Dr. Whitney Sippl is a women's health physical therapist, a board certified women's clinical specialist, and a mama of 2 little ones. She treats women in their homes throughout Orange County and also at a clinic in Costa Mesa through her company, Restored Physique Physical Therapy. She's passionate about promoting awareness, well-being, and healing with the goal of empowering women during the prenatal and postnatal periods to address discomforts or concerns. So Dr. Whitney Sippl, welcome to the show. I'm so excited to have you on. So tell me a little bit about your background and the things that you're passionate about.
Yeah, so I'm a pelvic floor PT. I've been a PT now for over 10 years, and I've specialized in pelvic floor ever since the beginning. My passion is really, in the beginning, I was at a clinic in New York City, and we saw everything pelvic, whether it was like my youngest patient was like 18, my oldest patient was 92. So the whole range of pelvic floor. And then I really started to specialize into pregnancy and postpartum about a year in. So now that's almost all I treat is all pregnancy, postpartum. And then I also, now that I've been doing this for so many years, a lot of my moms have been contacting me as their kids are getting older and having issues with like bedwetting or constipation, some of that kind of stuff. So I've also been doing pediatric pelvic floor work as well. But I still do kind of all pelvic floor. A lot of my moms, once I start working with them, they start talking with their moms.
Yeah.
And so then the grandmas are just like, what? I need to fix stuff too. So we see the whole range, but pregnancy and postpartum is like the big focus.
Yeah, I remember when I first met you and learning, you were teaching me, and I was like, wow, I did not know that we needed to do these things after, having a baby, and the things that we can do to, fix the scar tissues or, put our stomach back together. I forget what that's called. Diastasis. Oh my God. I had that so bad with my first son. So tell us kind of what you would tell a mama for recovery, whether it's a C-section or a vaginal birth. I know that there are 2 different things that you would want to do. So why don't we just kind of go into how you would instruct a mama, to get their body back?
Yeah, so it's actually standard of care in other countries to get pelvic PT after you have your baby. That's standard. Here in the US, most people don't even know that we exist, that my profession even exists. A lot of people don't know that they can fix any of the common symptoms that happen. So one of the things that I like to teach everyone is there are a lot of symptoms that moms can experience, which are common symptoms, but they're not normal. So things like peeing your pants, that's a common thing. A lot of moms complain about that. They can't jump on a trampoline. They can't, or when they sneeze, they'll pee their pants. That's a common thing that happens, but it's not normal. It's not something we have to live with. Pain with sex, that's another one. It's not normal to have pain. So I a lot of times like to start with teaching everyone, there are a lot of symptoms that you can have both during pregnancy and postpartum, but there are things we can do to fix it. You don't just have to live with it. Yeah. Even if a lot of medical professionals are just like, oh yeah, you had a baby, that's just what happens. Or like our moms are just like, oh yeah, well, I peed my pants ever since I had you. Welcome to being a mom.
Yeah.
So one of the things that we like to do is a 6-week check. So typically everyone knows that they go see their OB or midwife at 6 weeks for them to clear them for sex and exercise. Now, it doesn't actually mean that you're ready for sex or exercise, but you've gotten the A-OK that everything's healing how it's supposed to from their standpoint. This is when it would be ideal, and this is where in other countries women do this, is after your OB or midwife appointment, you immediately go see a pelvic PT. So then we spend an hour checking all of the pelvic floor muscles, and this is regardless of what type of birth you had. So even if you had a C-section or a vaginal birth, we still want to check the pelvic floor muscles. One thing that a lot of my moms after C-sections are often kind of confused about is, well, if I had a C-section, then why would I be having painful intercourse, or why am I peeing my pants? Because women after C-sections can still have those symptoms. And so the pelvic floor is involved either way, regardless of if the baby comes out that way. So we check all of the pelvic floor muscles to see what's going on with the pelvic floor. These muscles can be too tight, which can cause pain, just like a knot in your shoulder. You can have knots in your pelvic floor. And so we treat it the same way. We check the strength. So we want to see, how well do you do a Kegel? Can you squeeze and have a nice, good closure? Can you fully relax on command? We need that to be able to control our urine, gas, and stool. We also need that for sex. So some of these muscles in the front go to the clitoris. So that helps with clitoral stimulation. We check if there is any scar tissue. That scar tissue has to be really mobile so that the muscles can function how they need to. If there's a C-section, then we're checking the scar tissue above the pubic bone. Also making sure that that's really nice and mobile. We should be able to lift it, move it, roll it. Otherwise,
oh my God, the sound of that, I'm like, ah.
I know. That's when a lot of moms are just like, what, really? And we need to be moving all of this tissue, because otherwise moms will complain of that C-section shelf look, where no matter how flat you get your stomach, it just kind of has that overhang at that scar tissue.
That little
scar
pout
gets appeared. Yep. Yeah. And so we want to prevent that. And if we can get started on that at 6 weeks, that's great. And then we also check for diastasis, so that separation of the abdominal muscles.
And can you tell women how to find out about the diastasis? I'm sorry if I'm saying it incorrectly, but like how to test for it, because I felt like that was mind blowing. Like, oh my God.
Yeah. So what you do on yourself is you lie down, and I will show.
Oh, we lost your screen.
Oh, okay.
Video. Okay, perfect.
I'll show it on the ground. So lie down on the ground. You want to have your knees bent. And what we're doing is we're measuring. So we're measuring how separated the muscles are here. So those 6-pack abs from the rectus abdominis muscles go from the ribs to your pubic bone. So I have people take 3 fingers, and we want to put them in widthwise and see what happens when we do a little head raise. So you'd lie down, take your 3 fingers, sink them down into right into your belly button, pretty much. That's where you can start.
Okay.
Then you lift your head up, and then you can feel, if you don't have a diastasis, these muscles squish your fingers together. So for me, I have about half of a finger width. Now, if when you lift, you don't feel the muscles tighten or harden next to your finger, then you might have to add fingers. So the widest I've seen was 8 fingers. Yeah. And I've seen that a couple times now, where when I pressed in and she did the head lift, I couldn't feel the muscles at all. So then you just keep adding fingers until you can feel those edges of the muscles. So our goal is we want it to be about 2 finger widths or 2 centimeters or less. That's for the width of that diastasis. So it's considered normal if you have less than about 2 finger widths of a separation. Now, the other thing to check for with the diastasis is, let's say that this is the abdomen. When I press in, we can see how deep that diastasis is. The depth to me is actually much more important than the width. But
why is that? Why is the depth more important than the width?
That tells us a lot more about function. Okay. So I would much rather have someone with a 3 finger width gap. So the width is 3 fingers, but I can barely get in because it feels like a nice taut trampoline versus someone with 1 finger, which now technically they don't even have a diastasis. But for some people, they have 1 finger, but I can sink down and touch their spine. And that's because the tissue between those rectus abdominis muscles has thinned, and their muscles aren't able to get tension on that tissue, which means then when they lift their baby, they push a stroller, they do any exertion, they're not getting the stability around their core, which can lead to back pain. It's also associated with pelvic organ prolapse and incontinence. So
Okay.
we want to address both the width, but even more importantly, the depth.
Okay. Now I know that you can kind of see signs that this might be happening when you're pregnant. I know one of them is like your belly button sticking out. Like, what are some common signs for pregnant women that, they might be having this issue with their stomach? And then also, what can we do to cure it?
Yeah. So during pregnancy, the big thing that you're going to see is coning. So the midline of your abdomen, the biggest one for anyone who is pregnant right now, try leaning back. If when you lean back, you notice that your belly kind of tense or cones or kind of peaks in the middle,
Mhm.
that is diastasis. So that's the increase in abdominal pressure pushing forward against weakness in the tissue in the front. So during pregnancy, if you see that, you have two options. One, avoid whatever's causing that.
Mhm.
So just don't do that movement. Two, if it's a movement that you have to do, or maybe something you'd like to continue doing, you can see if you can still do it safely by doing a little Kegel, and then engage your abdomen like you're pulling the baby to spine. So you just do that little squeeze first, then do the motion. If you're able to keep it nice and flat, then you can keep doing it. But if even when you squeeze, it still cones, then
Mhm.
that's a movement you want to avoid. So avoiding the things that cause the coning, that's one of the ways to prevent the diastasis. I love teaching all my pregnant mamas myofascial release.
Mhm.
So you can do abdominal myofascial release where you stick down onto your skin. I typically say start by the ribs, stick down to your skin and pull towards the midline. And you can do that at the level of the belly button. You can also do it from below. I have a really great video on my Instagram under the IGTV. It was the first video I ever posted. It was me showing how to do that on my pregnant belly.
Oh,
And
okay.
so you can really see exactly how to stick down and pull. And
We'll
what
have to
that,
get that to the audience so they can check that out.
yeah, what that does is then it softens that tissue along the sides so that then there's not as much of that pulling and tugging and tearing in the front.
Mhm.
I also have found a lot of my moms who do that while pregnant, they notice that if they had like itchiness or that tearing sensation during little growth spurts,
Mhm.
that all goes away because then the tissues are nice and soft. They have that flexibility so they don't get those discomforts. So that's what we can do during pregnancy as prevention.
Okay.
Now, postpartum, if you already have it, then we actually do pretty much the same thing. Typically, a lot of manual work along the sides, because if this tissue on the sides ends up staying tight, it'll keep pulling these muscles apart
Yeah.
and they never get the chance to come back together. So
Mhm.
we need to do myofascial work and soften everything along the sides, even all the way from the back.
Mhm.
And then that takes off that tugging from those abdominal muscles. You can do some little splinting to train the muscles to
Okay.
activate closer together. I'll
Mhm.
typically have people do like mini crunches while holding the muscles together. And then we really have to target that transverse abdominis. So that's the one, it's kind of like a corset around
Mhm.
our abdomen. That's what helps to flatten our stomachs. It helps to stabilize everything around our trunk. That's the one we want nice and taut so that it provides all of that stability.
Perfect. Yeah, I know. I remember learning about this about 3 years ago, and I was like, wow, I had no idea. And thank God I found you because I had it really bad with my first pregnancy. And we were able to push me back together, and it made such a difference in my tummy area. So is there anything else? What else do us mommies need to know for body recovery? what's considered conditions that are normal, not normal. I mean, I know we kind of went over that a little bit, but what else can you give, any other advice?
Yeah, just know that our bodies went through so many changes for 10 months.
Mm-hmm.
Then we had a baby.
Mm-hmm.
Then we started deconditioning during our recovery time, those first few weeks. So exercise postpartum is very humbling.
Mm-hmm.
So anyone who has had a baby and then started exercising, you've probably noticed that your strength isn't as good as it used to be. The endurance maybe isn't as good as it used to be. And that's okay. We
Mm-hmm.
need to start with where we're at, and we need to safely progress through exercise.
Mm-hmm.
So I like to teach moms, when you get that 6-week clearance, that doesn't mean you should go be doing boot camps and start training for a marathon.
Like boxing, using your core.
Yeah. It's just too much for
Mm-hmm.
tissues that haven't been worked that well. And even if you were really active during pregnancy and you exercised until the day you had your baby, that exercise can, your muscles are in a different position. And
Mm-hmm.
so those exercises are helpful to keep you toned and everything, but they're not training your muscles in the position where we need them to be.
Correct. All right. Well, I have 4 questions for you before we get to the end. And here we go. So the first question is, who and what inspires you?
That's a good question. I would just say my moms.
Oh,
I love teaching moms and seeing them through, especially through pregnancy, birth, postpartum. Like, I start working with some of my moms. I just saw a mom that was 4 days postpartum.
Mm-hmm.
And really it inspires me to be able to go through and teach all of these moms.
Yeah. Okay. Second question is, what is something you wished you knew when you were younger?
Oh gosh. I wish I knew anything about my anatomy down there.
Yeah.
We're not taught any of this stuff. Luckily, I got into this field before I had kids, so I was able to do a lot with pregnancy and prevention.
Mm-hmm.
But it would have been nice to know a little bit more about that earlier.
Perfect. And then what is an essential part of your daily routine?
I would say I do regular pelvic floor exercises every time I brush my teeth. Oh, so perfect. I'm just getting it in. I'm getting that pelvic
killing
floor.
2 birds with 1 stone. You got it.
Exactly.
Yeah. Yep. Multitasking. That's mama right there.
That's right.
And last question is, best advice you've ever received?
Ooh. I would say to go with the flow, especially with labor and postpartum. We can't control everything. And so to be able to have that smooth, just okay, I can handle this. I'm just going to take what's at me and just go with the flow. I think it takes a lot of stress and pressure off. Mm-hmm. So I'd say
it is very sound advice. I will second that. You just got to go with the flow. Let it be. Sometimes your birth plan is never going to be what you think it's going to be. And yeah, so again, thank you so much for coming on today. And Dr. Whitney Sippl is so nice and generous that if you mention this podcast, if you mention Christina, she will give you 20% off her online course, And if you just use code PP20, I'll also put it in the description in the blog, you get 20% off her online course. And I would totally recommend it. And check it out for any mamas that are expecting babies or just had babies. Go check out Whitney. She's going to be an array of information that you need to help you get back to your body. Any last words, Whitney?
Yeah, I think that's it. Feel free to check me out on Instagram. I'm posting tips. Pretty much every Monday is all about pregnancy. Tuesday is postpartum. Wednesday is pediatric pelvic floor. So I'm always posting little tips.
Perfect. Okay. Well, thank you so much for taking time out of it today, and we will see you again. Bye.
Good. Bye.